So really what we rely on in clinical medicine are symptoms. And there's known symptoms of nitric oxide deficiency. The first one is an increase in blood pressure. And 2 out of 3 Americans have an unsafe elevation in blood pressure. And really the first sign and symptom of nitric oxide deficiency is erectile dysfunction. And that's in both men and women, and vascular dementia, insulin signaling. So when you lose the ability to regulate blood flow or to increase blood flow, improve perfusion, to select organs upon need, then that's a sign of nitric oxide deficiency. And collectively, that's referred to as endothelial dysfunction.
Chronic disease is characterized by decreased blood flow to the affected organ. But it's also appreciated if you can restore blood flow and get oxygen and nutrients to those specific regions of the body, you can correct many of these chronic conditions. So obviously the very important question we asked was, how do you restore blood flow and perfusion to all organs, tissues, and cells throughout the body? Can you do that through this molecule, nitric oxide? And this was the front page of the New York Times the day the Nobel Prize was awarded in 1998 for the discovery of nitric oxide by Bal Fuster, who was then president of the American Heart Association. But he was cited as saying the discovery of nitric oxide and its function is one of the most important in the history of cardiovascular medicine. And over 20 years later, that quote still stands true. And I'll take you through some fundamental discoveries that really changed the way we thought about nitric oxide. So for years, we thought nitric oxide was just a simple vasodilator, meaning that it opened up blood vessels, improved oxygen and blood flow and nutrient delivery. But this study here by Jonathan Stammer back in 2015 showed that nitric oxide is really what it is, a signaling molecule. But the signaling aspect is far more important than we could ever realize, because nitric oxide binds to hemoglobin in the red blood cells that carry oxygen. And it's this nitric oxide binding that allows for the oxygen exchange in the periphery. So without nitric oxide bound to the cysteine residue in hemoglobin, that oxygen does not come off. It basically prevents this allosteric delivery of oxygen in the periphery. So this is very important in critical care medicine, because if you give patients 100% oxygen, you can improve their O2 sats, say normal 98, 99%, but yet they're systemically hypoxic because without the functionality of the nitric oxide, the oxygen doesn't come off. So to correct for not just perfusion or any ischemic disease or hypoxic disease, you have to fix nitric oxide-based signaling in hemoglobin to not only get the blood flow there, but to actually deliver the oxygen from the hemoglobin in red blood cells. And it's far more important than that. As I mentioned, 170,000 papers published. So if we go back to the very basics, and I like this quote from the 1600s, that a man is as old as his arteries. And we can appreciate that because we know through years of research that the older you get, that your blood vessels become a little bit stiff, you get plaque and fat deposition under the lining of the blood vessel. Over time, this plaque becomes unstable, it ruptures, and that's the #1 killer of men and women worldwide as it relates to cardiovascular disease. We also know that the functional loss of nitric oxide production in the vascular endothelium precedes these structural changes by many years, sometimes decades. So when you lose the ability to make nitric oxide, it really sets the stage for fat deposition, inflammation, oxidative stress, and immune dysfunction that occurs in cardiovascular disease. It's also appreciated that if you can prevent the loss of nitric oxide production, you can prevent this whole progression of cardiovascular disease. So if nitric oxide is so important, which we know it is, then the fundamental question we asked was, how do you control and regulate nitric oxide production? And I won't go into the detail, but there's 2 pathways to make nitric oxide. The first one is through an arginine pathway, and this is through an enzyme called nitric oxide synthase, or NOS. The other is through a dietary pathway, which makes for an interesting interventional strategy. Inorganic nitrate found in green leafy vegetables can be metabolized into nitrite and nitric oxide. So each pathway provides about 50%. One can compensate for the other, but when you have endothelial dysfunction, which means that you've lost the ability to convert arginine to nitric oxide, and you have a poor diet or mouthwash use, PPI use, and you shut down this other pathway, then bad things begin to happen and symptoms set in and disease progresses and advances really rapidly. If you look at just the first pathway, this is the NOS pathway, for endothelial dysfunction. So the older we get, the less nitric oxide we make through the nitric oxide synthase, meaning that the older you get, the less efficient you become at converting arginine into nitric oxide. Now this is important because there's a number of nitric oxide products on the market that have L-arginine. So you never lose you never become deficient in arginine, you just lose the ability to convert it to nitric oxide. So what these 4 independent studies show that, by the time you're 40 years old, you only have about 50% of the nitric oxide you had when you were young. So we thought, well, if you can prevent the age-related decline in nitric oxide production, can you prevent age-related disease? And the answer is yes, and I'll take you through that. So when you become deficient in nitric oxide, or you lose the ability to produce nitric oxide through either pathway, these are the clinical consequences. You develop high blood pressure, you develop sexual dysfunction, vascular dementia, Alzheimer's, diabetes, peripheral artery disease, small vessel disease, things like Raynaud's syndrome, atherosclerosis, blood clotting disorders, acute respiratory distress syndrome, heart failure, kidney injury, immune dysfunction, again, susceptibility to infections. So it appears to me that every single human chronic disease, the things that really drain the healthcare system and the economy, is related to the treatment of chronic disease. And all of these are due to insufficient nitric oxide production. So if you can just fix this one thing, nitric oxide production in the human body, you can basically affect and control and better manage every single one of these chronic diseases. And I'll just take you through a couple of very simple concepts. That this is the single layer of endothelial cells. This is the smooth muscle that surrounds all blood vessels in the body. And this would be the pink part would be kind of the lumen of the blood vessel where the blood is. And when you can activate this through shear stress or exercise, that turns this enzyme on. And if you have normal endothelial function, then this enzyme is coupled, NOS enzyme is coupled, and it can generate nitric oxide. Well, then this nitric oxide that's produced diffuses into this underlying smooth muscle. With it being a gas, it can diffuse in all 3 dimensions. And it activates an enzyme called guanylyl cyclase. And this enzyme produces a second messenger called cyclic GMP. And this is the site of action of the mechanism for drugs like Viagra, Cialis, and Levitra that are approved for the treatment of erectile dysfunction. So nitric oxide turns this switch on, but then these PD-5 inhibitors like Viagra keep the switch on. That's the reason you're warned against 4-hour erections, and it's the reason there's all these really pretty serious side effects. But the important observation over the past 10 years is only about 50% of the men that are prescribed these erectile dysfunction drugs respond with better erections. And so that tells us that really the erectile dysfunction seen in both men and women is a condition of insufficient nitric oxide production. Because if you can't make nitric oxide here, there's no cyclic GMP to really provide a target for this type of therapy.
It's involved in the relaxation of blood vessels, allowing blood supply to the various organs. And you did mention it's also involved in what is called insulin signaling, so that deficiencies of availability or functionality of this chemical, nitric oxide, relate to things like insulin resistance and type 2 diabetes.
Lightning fixation, or these nitrogen-fixing bacteria that live in the soil. So any vegetables that we eat that are grown in the soil have a source of nitrate or nitrite or these nitrogen oxides. And when we consume them, then the body gets exposed to these nitrogen oxides, primarily in the form of nitrate. And then there's a human nitrogen cycle. So when we eat, for instance, spinach or green leafy vegetables, it's known that the body takes up inorganic nitrate, concentrates it in our salivary glands. And then there are bacteria that live in the crypts of the tongue, on the back part, dorsal part of the tongue, that metabolize nitrate into nitrite. And then so our saliva becomes concentrated in nitrite, provided we have the right oral bacteria. And then when we swallow our own saliva, the pKa of nitrite is 3.4, meaning that at that pH it becomes protonated and forms nitric oxide. So when we swallow our saliva, provided there's stomach acid production, this nitrite from our saliva is then formed into nitric oxide in the lumen of the stomach. And it's been shown that just swallowing our own saliva and having sufficient stomach acid production, you can inhibit gastric ulcerations from chronic NSAID use, you can kill ulcer-causing bacteria H. pylori, you increase gastric mucosal blood flow to enhance nutrient absorption, So this is a fundamental physiological pathway that's dependent upon, number one, a good diet, number two, sufficient stomach acid production, and number three, the presence of the right oral nitrate-producing bacteria. So if you're using mouthwash, you disrupt this pathway. If you're using antacid, you disrupt this pathway. Or if you're not eating enough green leafy vegetables, you become nitric oxide deficient, and you're at risk for cardiovascular.
Now, for me, where the story gets really incredible, and I recently did a podcast with a Dr. Mark Berhenna, who's a dentist. We were talking about oral health. We were talking about the bacteria in the mouth. And the story is that we can't change food-related nitrate into available nitrite that is necessary for the formation of nitric oxide, this incredibly valuable chemical that we've been discussing. We depend on bacteria mostly living in the mouth, but throughout the gastrointestinal system. But there's a lot of studies being done in the mouth that look at how these bacteria convert our food-related nitrate into nitrite that then becomes stored and available for nitric oxide production. So in a very real sense then, what you've said is that things like blood pressure and risk for diabetes are dependent upon the health and functionality of the bacteria in the mouth through the mechanism of their role in the creation of this very important chemical called nitric oxide. As such, if you damage those bacteria, there could be hell to pay. How do we damage those mouth-related bacteria?
The second problem, if we begin to really delve into the individual mechanisms, we know that nitrate is inert. Nitrate must be reduced to nitrite by the commensal bacteria because humans don't have this enzyme. So there's additional problems because 200 million Americans wake up every day and use mouthwash. Kills the oral bacteria. Over 200 million Americans are using antacids, things like Prilosec, Prevacid, these proton pump inhibitors. That disrupts this pathway. And over 200 million prescriptions are written for antibiotics every year. So that tells us that the majority of Americans aren't able to utilize nitrate from the diet or even through supplementing through some beetroot products or dietary supplements.
We were one of the first people to demonstrate the role of oral bacteria in the regulation of systemic blood pressure. And so now we're finding, and we've published, 3 or 4 papers on this, where if you disrupt the oral microbiome, the oral flora, it leads to a downregulation or decreased production of nitric oxide, and we see an increase in blood pressure. And then all the other symptoms that follow nitric oxide deficiency are ensued. So how do you do that? Well, if you use mouthwash, any type of antiseptic mouthwash, 2 out of 3 Americans wake up every morning and use antiseptic mouthwash, killing the bacteria, leading to an increase in blood pressure. And also, you lose the protective benefits of exercise if you use mouthwash. So that's number one. And I tell people, if you use mouthwash, you have to stop. I mean, it's a risk-benefit analysis. And we're finding as science progresses that the risk of mouthwash and killing the nitric oxide producing bacteria far outweigh the benefits of killing any gingival caries-causing plaque. The other is fluoride. Fluoride's a neurotoxin. It's an antiseptic, and it destroys your thyroid function. So we have to get rid of fluoride-based toothpaste. We have to filter the fluoride out of municipal water systems. And then the other, are antibiotics. 200 million prescriptions written for antibiotics every year. And there's
with a more kind of a detailed controlled study by taking normal-tensive, healthy individuals and giving them mouthwash twice a day for 7 days. And then looking at how this changed the oral microbiome and what effect this had on their blood pressure. And this paper was published last year. But this is just one example of one patient. So 1 week mouthwash use in one patient caused a 26 millimeter increase in their blood pressure. So meaning that nothing changed. This was a 21-year-old dental student, very healthy, good diet, physically active, and nothing more than giving him mouthwash for 1 week, his blood pressure went up 26 millimeters of mercury, making him clinically hypertensive. And we were able to determine and identify certain bacteria that disappeared when his blood pressure went up and certain bacteria that reappeared when his blood pressure began to normalize.